Let's move on to our next topic, which is a central venous access device. Okay, you should be knowing, like, when a patient is going for a major surgery, at those times, just before the day of the surgery, the patient will be subject to these procedures. Meaning, it is a central venous access device. Why are they accessing a central vein? What forms a central vein? So we should be knowing all that. So what is a central vein? So any vein right from this brachiocephalic vein or the superior vena cava or into the right atrium constitute the central vein. Okay. So these central veins are also listed in your CPT manual so that you can very well understand what forms a central vein. If the tip of the catheter does not end in a central vein, then you will have to use modifier 52. Okay. Now let's see what is the purpose of a CVAD. CVAD devices are usually placed in order to provide nutrition or nourishment, or sometimes to deliver the medications. Say a patient is a cancerous patient. Say a patient is suffering from a malignancy. At that time, they will have to provide antineoplastic or a chemotherapy. So they would resort to a CVAD procedure. Now, coming to the coding of this CVAD procedure, what you need to know are very simple rules. One is whether the procedure is a tunneled one or a non-tunneled one.